Hi, I'm Hazel. I'm a chiropractor, yoga and breathwork instructor, and today I'll be talking you through my version of the nerve flossing technique, particularly for the sciatic nerve. So the reason you might want to do this exercise is if you've been diagnosed with true sciatica, and that is what we would refer to as a radiculopathy. And that is where the L5 or S1 nerve root is being compressed and is usually sending symptoms down your leg. The most common area for the symptoms to run are either right down the back of the leg into the calf, into the back of the foot, or down the back of the thigh into the side of the calf and into the side of your foot. Otherwise, it may be that you don't have a true sciatic problem, and it may be that you have muscular referral. This exercise isn't going to do you any harm then, but you probably won't feel that it's very effective. Doing this exercise in and of itself is almost one way of kind of confirming that it's likely to be a nerve tension rather than just a muscular problem, because by doing this exercise we're essentially stretching and flossing the nerve as it runs from our head down through the spinal cord and out into the lower limb, and it isn't a muscular stretch as such. So it can be actually a useful way of differentiating say a true sciatic radicular problem of the low back from something that's just more a generic low back pain. And the reason why that's important is to know if you have a true nerve issue, because nerve issues are tricky, they're painful, and they're very difficult to treat. And so the expectation from treatment would be very different to someone that was suffering with just muscle pain or joint pain that's coming from the low back. So it is good to make sure you've got a proper diagnosis to know what you're dealing with. But as I said, it's not going to do any harm though if you're not sure what's currently going on for your low back. So usually you would have pain down one leg, that would be your involved side, and usually that's where the nerve is being pinched on that side. The most common reason why the nerve is being pinched is a disc bulge. The disc in the low back, in this case it would be the L4, L5 or the L5, S1 disc, is bulging, so it's come out of its position and it's pinching the nerve. So let's say you're getting problems going then shooting down your right leg, and this would be pain, shooting pain. It may burn, or you may get also tingling or sensation of numbness. So let's say your involved leg is the right side, you would lie on your left side with that leg on top. You could do this in bed, and I would recommend that really rather than trying to get onto the floor. And make sure you have a cushion under your head for support. And as you are on your side, you will then start with both of your knees bent. And keep your head in a neutral position looking forwards. Hopefully this is tolerable to be in this position while you do this exercise. And the first stage is to straighten the top leg. So once you straighten that leg, we'll start to be putting some tension onto the nerve. But keep your leg in a straight line to begin. And then as the leg comes forward, we will see how tense that nerve is. So keeping the leg straight, you would start to bring that foot forward. Now it's going to be important to keep this leg completely relaxed. So if you're doing it in bed, you may want to make sure that there's a cushion or something underneath it, as you don't want to be lifting the leg up at all. So you would start to bring that leg forward to a point of tension. And if you're suffering with this issue, it will be quite clear. So you'll get to a point where you'll lift up, and then it will start to cause you symptoms. Now you only want to take that leg forward enough that you just come into a tolerable level of tension or tightening into that leg. Whatever the angle that is, hold that leg there, and then you're going to point your toe and tuck in your chin. And then you flex your toe and take your head to look forwards once more. Point your toe, tuck in your chin, and then flex the foot, take the head to look forward. So I'm not lifting my head off the pillow, so there's no tension in my neck. If able, repeat this maybe 5 times. and then make sure you bend the knee. That should take the tension off of the nerve, and rest. You might want to do some self-release with your knuckle into the glute slightly, into the back of the thigh, into the back of the knee, into the calf, and then you may want to repeat that. So again, I would start with the leg down and straight and take it forward into the point of tension. Hopefully, as your nerve becomes less irritated, you will have more tolerance to bring this leg further forward before you get symptoms. And we would see that as progress. So the more forward this leg can come without tethering that nerve, the better, essentially. And feel free to mix this up. So we can't say exactly where that nerve is necessarily being pinched unless you've had a scan. So play with it. You may find that doing some release to the leg as you do this helps. You might want to soften the knee and come back into it. But what you don't want to do is take yourself into a real position of intolerable pain as you do the exercise, because all that will do is increase inflammation. And a lot of what we're trying to do with sciatic issues is to decrease the inflammation and calm down your nervous system. So please only work in a tolerable level of discomfort as you do this exercise. And of course, if it's not working for you, please stop straight away, rest, and obviously if needed, seek medical advice. Just wanted to say a little bit at the end about Cauda Equina, and I've also put this in the notes for this video, that with nerve issues, it's generally not anything to worry about. It's frustrating and painful and sometimes does need referral for further care, but it's not serious in terms of life serious. There's only one condition that is particularly very serious, and that is Cauda Equina. So I just wanted to highlight this at the end of this video. And the symptoms of Cauda Equina are very specific, and it's when the nerves that supply your bowel or bladder have become compressed. So these are different nerves to the L5 and S1. And these nerves, if irritated for too long, can actually lead to incontinence. So it's really important that if you get Cauda Equina symptoms, that it's treated straight away. The most obvious signs are losing the ability to control your bowel or bladder. So that means weeing yourself or pooing yourself. It would be a real sense of urgency where you basically can't get to the toilet in time. This is usually associated with pain that can go down both sides of the inner parts of the leg, but specifically numbness right under here. And the way that might present itself to you is when you go to the toilet and you wipe yourself after a tissue, you cannot feel the tissue in and around this region. And we call this saddle anesthesia. So it's quite obvious usually if you have Cauda Equina. So please don't worry if you think, oh, maybe I'm a little bit constipated. That's not what's happening here. It will usually be very obvious and, like I say, associated with a real loss of sensation around this area. And you can always call 111, the NHS helpline, and they'll talk you through any symptoms that you might be concerned with, and they would be able to advise you if they do deem it to be a medical emergency. Thank you.